Dr. Angelino. We have a couple more speakers and then we're going to turn it over to you. So if you've got questions, get ready. We've got microphones where you can ask those questions and we can get into a good discussion on this topic. And you can hear directly from the doctors on how this is going to impact you as a patient or members of your family. Our next speaker is the Chief of Psychiatry at the Ottawa Hospital and a Professor of Psychiatry and also Associate Chair of the University of Ottawa Department of Psychiatry. Please welcome Dr. Robert Swenson.
Thanks very much. I have a really neat job and in a healthcare system that I am very passionate about. I'm here as a practicing doctor, not to represent the hospital. But let me tell you a little bit about what I do and my concerns about the proposals that the government has already implemented, some of them, and what they're proposing to do. As I said, I'm very passionate about our healthcare system. I trained in the U.S. and have visited many places, including some very good hospitals in Boston, at Harvard University, San Diego, but I really believe we have a wonderful caliber of physicians in Canada, in Ontario, and the care I've seen is fantastic. I work as a department head on the senior management team, and I think we've got one of the best hospitals in the country. We've delivered care with a balanced budget for years. How do we do this? Well, if you look at our team, when we plan for the hospital system with ever-decreasing revenues, we've got a table with physician leaders sitting with hospital administrators. And in the room, there's tremendous respect. And if an administrator says, well, what about this? Well, we got to look at this, you know, it's costing too much. We've got the counterbalance of the physician saying, well, yeah, but you got to consider what this will, the effect it'll have on the patient. The patient is at that center of the table. And we work together. And if we don't have that in our healthcare system, healthcare planners working with the input of physicians, we're not going to have the healthcare system we have now. And my huge concern is that's what the government has done. They've made decisions with no input of the physicians, the Ontario Medical Association, which has always been consulted about health care in recent years, in terms of programs, giving our input, and considering the patient first and foremost. It hasn't happened, and that's a huge concern. You cannot maintain a quality healthcare system, province-wide, hospital-wide, and in the community without physician input. Secondly, I'm a clinician. I have a fantastic job working with family dogs. And this has been part of a great initiative over recent years where specialists like myself work within family health teams. And what, as a clinician, I've found, and I have a great deal of concern about, is what we're seeing now are, in the healthcare system, are folks with chronic illnesses, diabetes, cardiovascular disease, frail elderly, Alzheimer's, and they need continuous care. And hospitals have been structured to provide episodic acute care. But where money has gone in recent years is to improve the care of chronic illnesses. And there are several initiatives by the government that's going to take suddenly that money away. And doctors won't be allowed to give the care for folks that have these chronic illnesses to optimize their quality of life. And that's what we want. If we start going backward in our care for diabetes, for heart disease, for all those illnesses, and take away the incentives and the funding to provide excellent chronic care and palliative care, then what kind of a healthcare system are we going to end up with? And finally, I have a real privilege, and it's a tremendous privilege every day to be a clinical teacher, to see young doctors who are a lot smarter than I am coming through the pipe, and I want them to practice, because I'm going to need their care, my parents need their care and expertise, and I learn from them. And and they want to practice often in a different way, with a lot of the new programs that the government have put in place that now aren't going to be funded with some of these initiatives. So one, the government didn't ask for input. Two, on planning the healthcare system and funding the healthcare system, it didn't ask for physician input. Bad decision. Secondly, there are many programs that have improved care that are going to be severely affected. The government, the very government that has put money and incentives for us to do more cataracts, are now saying, no, we can't afford more cataracts. They do a 180, and that's called planning a healthcare system. And thirdly, if we don't have these young doctors staying in Ontario and providing the care we want and that we deserve, then I'm not so certain the public's going to support the government in these initiatives. And and the previous speakers have said, we're going to drive the young physicians away. Thanks very much.
Thank you, Dr. Swenson.